Hi there. Welcome. This presentation is titled A Caregiver's Perspective. Please prioritize caregiver health literacy for the 22nd Annual Health Literacy Conference. My name is Amy Hedman Robertson, and I am a professor for the Department of Health and Exercise Science at the University of St. Thomas. There I teach courses in public health and health promotion. Our learning outcomes for this presentation include list 3 common challenges family caregivers of older adults experience that could be alleviated with improved health literacy. State 3 reasons why family caregivers should be targeted populations for health literacy interventions. And describe 3 practical strategies healthcare organizations and professionals can employ to address health literacy needs of family caregivers. This presentation is inspired by my personal experience as a caregiver for my father. Myself and my mother have provided care to him for nearly 3 years. My father's health problems are complex. I'm involved in a variety of caregiving tasks that involve providing transportation, assisting with healthcare appointments, scheduling and attending them, navigating the healthcare realm for my father, making sure that providers are aware of his medical history and know important information pertinent to his care. I work to ensure questions and concerns are addressed, that we have the information that we need. And I ensure too that mom and dad understand next steps and are able to provide informed consent and make sure that their questions are answered. I have studied extensively in health. I teach in health. I teach about health literacy and health communication. And I have found throughout the past 3 years that I have had challenges with feeling ill-prepared and ill-informed and trying to navigate this healthcare realm for my father and looking at comprehensive care and coordinated care and communication across those different providers, medical billing, transportation. There's been a variety of challenges that I've experienced in this short time. And I can only imagine what others experience in their unique caregiving roles and scenarios. Specific to our family, we've experienced accessibility challenges. My father is no longer able to walk, and so he is in a wheelchair and has very limited movement and control of his lower body. So transportation has been a challenge throughout these last 3 years, finding reliable transportation to do appointment runs when we have medical appointments or even for family events and affairs to try to schedule and organize that can be challenging. And there's also been quite a bit of difficulty in receiving proper clinical care due to facilities not having appropriate equipment or accommodations for someone in my father's situation. That has been disappointing and frustrating as well. There's also been several high-risk health incidents that have been very scary and serious, involving infection, wound care, bed sores, urinary tract infections, and even sepsis. And so through all these different challenges, I have learned a lot. I have gained great insight into improvements that are needed within our healthcare realm, and improvements that are even needed within myself and what I can do better to be more informed and to support and help my loved one navigate this time and these experiences. So in today's presentation, I just want to share some of those insights with you. 1/3 of Americans have a chronic disease. Chronic diseases develop slowly over time and include heart disease, diabetes, cancer, and dementia. And older adults are more likely to have multiple chronic diseases. And with that comes a higher risk of becoming disabled and needing assistance, needing the help from caregivers. Research indicates that older adults' health literacy is associated with various health outcomes, and low health literacy is associated with poorer health outcomes. But there really is not a lot of research about health literacy among caregivers and how that is assessed and how that can be improved upon. I am not alone in my role of caregiving. I share this role with at least 48 million other people who care for someone over the age of 50. Caregivers spend an average of 24 hours per week in caregiving, and 6 in 10 caregivers work while providing care. Caregivers help in so many ways. They provide complex care within the home. They help navigate healthcare and communicate with healthcare providers about a variety of topics that include medication management, symptom management. Caregivers also advocate for care recipients in a variety of ways. And many caregivers even pay for services to meet care recipients' needs. Caregivers provide a variety of types of care. These include household tasks, cooking, laundry, cleaning, personal care tasks related to maybe bathing and personal hygiene, but also play an important role in medical and nursing tasks that are often very complex, with no on-the-job training provided. Some examples of medical or nursing tasks might be catheter care, medication management, navigating healthcare, case manager, coordinating care across multiple providers and trying to integrate that, interpreting complex information and trying to simplify that and help it to make sense for the patient. They might also be involved in preparing special diets, performing wound care, assisting with mobility devices. And so there's a variety of tasks, medical tasks, nursing-related tasks that caregivers provide. And many of them do a combination of all these different types of tasks. Health literacy is defined in 2 ways. First, part of the definition of health literacy is focusing on the person. And so personal health literacy is at the individual level, and that is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and for others. And there's also this part of the definition that considers the organization's role in health literacy. So what hospitals, healthcare clinics, nonprofits can do, and that is referred to as the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions. It is essential for patients and caregivers to understand health information for ourselves and for our loved ones. With increasing healthcare costs, with the burden of chronic disease, with what's at stake regarding quality of life, as well as longevity of life, health information can really help us to make the best decisions with the resources available. And is so important that it is equitable, that people do have this ability to be able to find, understand, and use health information. Why health literacy matters. Studies have shown that those with adequate health literacy are more likely to participate in preventative medicine and healthcare, engage in annual or recommended screenings and checkups. Individuals with higher health literacy also understand the importance of early detection and what that means for treating disease. And they also understand the importance of disease management and take the steps necessary to do that. People with higher health literacy use healthcare services in an efficient way and share in decision making about their treatment. And they are more likely to follow and adhere to the treatment recommendations and to engage in self-management or proper management of conditions. The costs of low health literacy are high. Low health literacy is associated with a decreased ability to manage chronic conditions. So that might interfere with taking medications properly, might interfere with following recommendations from the provider or the physician regarding how to manage disease and stay as healthy as possible. Costs of low health literacy are also tied to higher hospitalization rates and longer stays when in the hospital, and unnecessary health costs. So difficulty accessing health insurance, difficulty understanding health insurance, making more frequent use of the emergency room, which is costly, and also sadly increased mortality. That difficulty in managing chronic conditions and not engaging in preventative care impacts one's mortality or death. And looking at patient empowerment and what that is, we see that health literacy is one of the many factors under skill development here that has been associated with the term patient empowerment. Patient empowerment in the research has been measured by how we feel and what insights we have, the experiences and capacities that we have, our actions and our behaviors, as well as skills, which include health literacy and digital literacy. So health literacy is also a skill that is embedded and tied closely to many of these factors listed here. So when we look at patient empowerment and we see self-monitoring and self-knowledge and self-confidence, health literacy is integrated into those areas. Health literacy is integrated into our ability to set health goals and to work towards that and to be actively engaged in our life and in our health. Health literacy is integrated into disease management, communication with our providers and with others, and collaborative participation in our healthcare, known as power sharing or mutual decision making. So health literacy is an important aspect of being an empowered patient. The research on caregiver health literacy is sparse. Few studies have conceptualized health literacy as competencies that can be developed, and even fewer have focused on health literacy development of caregivers. Some insights from the limited research that I did come upon revealed that an estimated 20% of caregivers demonstrate low health literacy, which definitely has implications on the care that they are providing. And those with low health literacy reported higher levels of difficulty with healthcare provider communication and navigating healthcare services and supports. O'Connor and colleagues examined caregiver health literacy and patient outcomes and found that limited caregiver health literacy was associated with poor physical function, greater comorbidities or more than one disease taking place at one time, and more emergency department visits in the past year. They concluded that caregivers with limited health literacy are caring for medically complex patients and need more support. Another study found that improving health literacy levels of caregivers contributed to improved dementia care abilities. Researchers have indicated that caregiver health literacy should be considered in doing patient assessments and interventions designed to identify and reduce the difficulty that caregivers experience in navigating healthcare. Thus, development of health literacy training for caregivers is needed. Caregivers' sources of help or information is documented in a report titled Caregiving in the USA. The report indicated that fewer than 3 in 10 caregivers had said a healthcare provider had asked about what was needed to care for their recipient. Caregiving in the USA survey found that 80% of caregivers reported having at least one source of help or information about providing care. But unfortunately, 20%, 1 in 5, have never gotten any help or information. Among those who reported receiving information, the most common sources were help from healthcare professionals, followed by family and friends. And about 1 in 5 relied on their local hospital or care facility. About 19% relied on government agencies or organizations. And 1 in 5 indicated that they get their information online or through social media. Interestingly, I conducted a Google search to see how can I increase my health literacy skills. And what I found out was that there were little results that were geared towards patients. Most of the information that showed up upon this Google search was written for healthcare providers, was written for healthcare organizations, was related to research and more academic articles. And so for individuals seeking to increase their health literacy or even learn more about health literacy and see what resources exist, it seems to be a term that isn't as mainstreamed into the public as it should probably be, so that people can be linked to that information and be linked to those resources. Organizational health literacy is important. Yes. So important. But so is personal health literacy. Health literacy interventions and initiatives have largely focused on healthcare providers and organizations and not the patient or the caregiver. Interventions to improve personal health literacy are direly needed for both patients and caregivers. So if we can build the skill, people can use the skill lifelong. It can benefit themselves, it can benefit others. And we don't necessarily then have to rely so much on the provider or the healthcare organization to meet health literacy needs that we have. It can be a dual approach where patients are empowered and physicians and providers are empowered to both address health literacy. So resources that empower patients and caregivers to increase their health literacy are needed, as well as dedicated efforts to build patient and caregiver skills. And that can be done through a variety of skill building experiences that could involve demonstrations and guided practices and resources. And I know that many of these things are already being done in a clinical setting, but they might not be done in a formalized or consistent manner available to all patients. One tool or one example that I find really helpful with just improving health literacy, I found through some work is this tool called Ask Me 3 from the Institute for Healthcare Improvement. And it's a tool that basically helps patients know a few questions, where to begin when talking with their provider. And they have a worksheet available online that kind of indicates these questions and provides here a space even to write the responses, prompting patients to ask, what is my main problem? What do I need to do? And why is it important for me to do that? And I think that's a great example of a practical, tangible tool or worksheet that could be provided to patients to help empower them in their visits. For me, in looking at my experiences thus far, I think it sure would have been helpful to have information on expected challenges or perhaps high-risk situations where it's a pretty serious situation, but Not sure if it's appropriate to call, who to call, how to navigate that, or once we are discharged or home from the hospital, how to kind of work through some of the concerns that arise. So I think more information about how to provide care in those particular situations definitely would have been helpful. Information too about local resources, and that could be care cap services, reputable home health agencies, how to set up home nursing services, inquiring about insurance and navigating that area, where to look for online trustworthy information. And if I'm not online, where can I get trustworthy information from other traditional sources? Educational materials would be super, super helpful. And guidance on what questions to ask. Just like that Ask Me 3, we don't know what we don't know. And so it's good to have some guidance on potential questions that we can pose when we are visiting with different providers or medical doctors, surgeons, etc., to be able to be prepared for those appointments. And definitely care management classes. So places in person that we can go and attend classes, that caregivers can receive support, can meet other caregivers and receive important information about how to provide appropriate and safe care for their care recipient. I think it's important for organizations to keep in mind that we do not know health literacy based on just looking at people, and so checking assumptions there is important, and maybe even best to assume that all people could use and could improve their health literacy when delivering information. Two, not everyone is online. Some people do prefer traditional print materials, tangible resources that they can take home, especially older populations. I know my parents are not online, and so they rely on me to check the patient portal systems, to even set them up and to check them. And so not everybody goes online, has access to online, or cares to even be online. And so what are they missing out on that information that's available for those people who are online? And that's referred to as a digital divide, that we're creating disparities by placing so much emphasis on online. And so how can we meet the needs of all patients? And how can we help support caregivers through instruction and support and involve them in patient care? CDC, or the Centers for Disease Control and Prevention, states that every organization involved in health information and services needs to have its own health literacy plan. Without an action plan, organizations' improvements to address or improve health literacy will be fragmented and likely not successful. A 2012 discussion paper highlighted 10 attributes of health literate organizations, and this table on the left-hand side showcases 3 of those attributes: to provide easy access to health information and services and navigation assistance, to design and distribute print, audiovisual, and social media content that's easy to understand and act on, and to address health literacy in high-risk situations, including care transitions, and communications about medicines. And on the right-hand side are some examples, and these could be some ways possibly to improve patient caregiver health literacy. Provide practical ways, such as making electronic patient portal systems user-friendly, but then provide that training. Teach people how to use that skill and to navigate that. Involve people in material development and design and pre-testing, making sure that they understand that material, especially if it's geared towards certain populations or specific populations with language differences. and prioritize those high risk situations, making sure that patients are prepared and have the information and resources needed to navigate that. This particular slide just showcases some information that I think would be helpful in patient education materials. I think providing information to prepare patients for appointments, as well as what type of questions to ask during the appointment. This information is found online in a variety of places, but it won't come up when you search for health literacy or patient health literacy. It will come up with search terms like how to prepare for a doctor visit. But what would be really nice is to kind of pair it and align it with health literacy. So when people are looking up, how can I improve my health literacy? How can I be more health literate? That resources and information like this are easier to navigate and to find. Providing information to them to help them be successful in their interactions with their healthcare will not only be beneficial short term, but long term, and improving that skill that they have. They can take that to future appointments, and they will be more prepared when they come, and will know what type of questions to ask, and their confidence and their ability to communicate with providers and to navigate that will improve over time too. Additionally, patients and caregivers could benefit from guidance on situations like when being discharged from the hospital or in the emergency department or emergency medicine. What are some considerations to keep in mind, how those appointments might be different from a traditional doctor appointment that they receive? What would be some specific questions to ask in each of these scenarios? I see that being important information to include with health literacy materials for patients as well. Given the important role that caregivers play in self-management support, insights into caregiver health literacy are critical, particularly if caregiving role has high clinical demands or the care recipient has low health literacy. There's a quote from UN researchers, UN and colleagues researching team. Indeed, more research is needed to understand what opportunities and needs exist for improving patient and caregiver health literacies and skills. But let's not wait for that research. In the meantime, let's provide patients and caregivers with helpful, empowering information and resources. In my experience, I am convinced that improving health literacy at the individual level for both patients and caregivers will improve health outcomes, improve quality of life, reduce stress, reduce caregiver burden, and lead to more efficient and effective healthcare delivery. An educated patient is empowered, thus more likely to become healthy. Quote from Dean Ornish. I want to thank you for your time. Please feel free to reach out if you have any questions or comments, and I wish you well. Thank you.